Good morning to you from the UPMC Hillman Cancer Center at the Indiana Regional Medical Center. It's good to have you with us today.
Nice.
You
Thank you.
you are an oncologist,
Yeah, that's correct. I'm a medical oncologist.
and you're working here in Indiana,
Yes.
and so we have a chance to talk with you and maybe plumb your mind a little bit and find out about what UPMC Hillman Cancer Center brings here to Indiana. And in particular, this month we focus a lot upon colorectal cancer. So let's start there and talk about colorectal cancer from an oncologist standpoint. How do you approach not only the diagnosis but then the treatment of colorectal cancer?
So I'm a medical oncologist, and we coordinate the care of cancer patients, and also we treat them with medical therapy, chemotherapy, biologics, and nowadays immunotherapy. So we're involved from the diagnosis of the cancer to the patient is cured, and we also help with monitoring the disease. We do surveillance and follow up patients with blood work and CAT scans. So for colorectal cancer, we promote obviously screening. Colorectal cancer is extremely common. It's the third most common cancer in both men and women. And American Cancer Society nowadays to have a screening by taking a stool sample. And in the past, it was yearly sample just to check for blood. But now we can check also the DNA, the genes from the cells, from the epithelium that are shedded in the stool. And we can predict if the patient has a high-risk polyp or cancer. And that test is called Cologuard. It's done on average every 3 years. Colonoscopy can save you screening for 10 years. If the colonoscopy is negative, we only recommend every 10 years. If there is a polyp that's found, it's usually every 5 years. But nowadays, with the option of testing of the stool, we can avoid invasive tests. There is another test with virtual colonoscopy. That's essentially a CAT scan, type of a CAT scan, which also may be chosen by the patient. But it's more rarely done because of the radiation exposure. In the future, there is a new blood test that's being developed. It's not approved yet. However, there'll be an option of just having blood sample taken every year or every few years to detect early colon cancer.
Just listening to you describe it, how quickly the technology changes and our ability to get a better handle on any type of cancer. In this case, we're talking colorectal cancer. And I want to use that term for a second. Colorectal cancer, that's actually putting together two different types of cancers, isn't it? Is there a difference between what we call colorectal cancer as a catch-all term and colon cancer or rectal cancer?
So there are a few differences. The rectal cancer is the last part of the colon, and the main difference comes from the fact that this is outside the abdominal cavity. It's in the pelvis.
Okay.
So there are differences in the treatment approach. We use radiation therapy for rectal cancer, unlike colon cancer, where we do not use radiation because the surrounding small bowels are very sensitive to radiation. Also, there is a difference in the surgical approach. Sometimes the surgeon cannot restore the continuity of the bowels when they resect the rectal cancer, and the patient may have to live with a stoma. Unlike the colon cancer, where the surgical approach is very straightforward, just a piece of the bowel gets excised. There are differences in the biology, in the behavior of the rectal and the colon cancer. The right-sided colon cancer is usually more aggressive. The colon cancer that arises from the left side of the bowels and the rectum is usually more indolent, and there are differences in the genetics, in the genes of those two cancers. So even the treatment, the biologics that we use sometimes is different.
Yeah, that's amazing. One of the things that I wanted to ask as well, and I've always wanted to ask this question, is we hear of a cancer that starts in one particular part of the body and then spreads to other parts of the body. Is colorectal cancer like that? You get it in the colon, does it stay in the colon, or can it affect other organs?
So this is a very important point. Luckily, most of the cancers that are diagnosed are localized, so the surgeon can essentially cure the patient just excising the piece of the bowel. However, if that cancer gets undetected and continues to grow for years, it will spread to the lymph glands initially that surround the bowel, and eventually will move to the liver and to the lungs. So we expect cure rate of 90% if the cancer is just localized in the bowel. However, that may decrease to 75% if it's in the lymph nodes. When it spreads to lung and liver, the cure rate may decrease further to less than 15 to 20%.
One of the other interesting things I recall from conversations with Dr. Clark is catching it in that polyp stage is extremely important, isn't it?
Yes, that actually prevents colon cancer because many cancers arise in a polyp. So if that polyp is got early and removed, then the cancer will never ever happen. So that's why probably we are seeing decrease in the incidence of colon cancer and decrease in mortality as well. So colon cancer is a success story for us because of the early detection.
Hillman Cancer Center, UPMC Hillman Cancer Center, working here at the Indiana Regional Medical Center has been just a wonderful, wonderful partnership and has really expanded the offerings here in Indiana. So you don't have to drive to Pittsburgh to get work done. You can get it done right here. You personally, working here in Indiana, is there a difference in working here as opposed to if you were working in Pittsburgh at the moment?
So the workload is way higher in Indiana, and I think because of geographic limitations, the patients would prefer to be treated locally with chemotherapy. Chemotherapy, immunotherapy, biologics, they're given every 2-3 weeks, and it's extremely difficult for a patient to travel all the way downtown. So we tend to see more patients here. It's busier clinic. So for our patients, please try to show up for appointments because this appointment would have been taken by somebody else.
Yeah, well, that's a very important thing. You know, you might be able to get away with that, and they would have others who could fill an appointment in other places. But here, it's extremely important because this service is so vital, and it's something that needs to be done. How's it been for you working here in Indiana?
It's been wonderful. I really like the people. I mean, they have been so nice and nice to work with, and I just like the community and this feel of small town. They know each other. We know everybody.
Do you work exclusively in Indiana, or do you go back and forth with Pittsburgh?
I work in Monroeville as well.
Okay.
So, yeah, part of the week I'm in Indiana and part of the week I'm in Monroeville.
Oh, we like you here. Just stay here.
Thank you.
We're talking this morning about colorectal cancer, but other cancers treated at the UPMC Hillman Cancer Center at IRMC. And the cancer protocols for dealing with any types of cancer, they constantly change. I would guess that you, in terms of educational value, you really have to keep up to date on changes because they probably come pretty rapidly in your industry, don't they?
Yes, and nowadays we cannot get away with just going to a conference every few months. The changes are daily. We have to follow up not only journals, we have to also watch the FDA alerts and our Cancer Society alerts on a daily basis. There are new medications for treatment literally every day. So my
Pretty
email is
exciting,
full.
though, isn't it?
It's extremely exciting. It's unbelievable time to be an oncologist, and hopefully this specialty will disappear one day because the cancer will be cured.
That would be wonderful, too. For folks to take advantage of your services, the UPMC Hillman Cancer Center at IRMC, obviously they would need a referral from their... The whole road starts with your primary care physician and then on to a specialist, and then if need be, they would be recommended to you. But it's good to know that you're here. And
thank you.
We're so appreciative of what you can do for us here in Indiana. Dr. Boriana Kamenova, thanks so much for visiting with us today.
Thank you for having me.
We appreciate it. It is the voice of Indiana County, WCCS AM 1160 and 101.1 FM.